Cervical cancer screening. As already mentioned, cervical cancer develops slowly over many years. The cells in cervix go through many changes before turning into cancer. So regular screening can help to detect cervical cancer. The American Cancer Society, ACS, recommends that women aged 25 to 65 have a primary HPV test every 5 years. If primary HPV testing is not available, screening may be done with either a co-test that combines an HPV test with a Papnicolo (PAP) test every 5 years or a PAP test alone every 3 years. If you are younger than 21, need no screening. If you are 21 to 29, have a PAP test alone every 3 years. HPV testing alone can be considered for women who are 25 to 29, but PAP tests are preferred. If you are 30 to 65, you can choose one of 3 options below. Have a PAP test and an HPV test, co-testing, every 5 years. Have a PAP test alone every 3 years. Have an HPV test alone every 5 years. If you are 65 or older and have had 3 negative PAP tests results in a row in the last 10 years, screening is no longer needed. If you haven't had regular screenings, continue getting tested until you have 3 negative test results. Most medical organizations suggest beginning screening for cervical cancer and precancerous changes at age 21. The tests are usually repeated every few years. Theses screening tests include cervical cancer screening test, PAP test, Papnicolo test, also called Pap smear. In this test, cells are collected from surface of cervix. These cells are examined for any irregularities or cervical cancer cells. It also can detect cells that have changes that increase the risk of cervical cancer. These are sometimes called precancerous cells. A PAP test may be combined with an HPV test. HPV DNA test, human papillomavirus, can be done at the same time with PAP test or by itself. This test checks the cell of cervix for HPV infection. Some HPV infection is linked to cervical cancer. The PAP test, often called the Pap smear test, was replaced by the cervical screening test in Australia in 2017. The cervical screening test is a better test that detects cervical cancer risk earlier and save more lives. The cervical screening test looks for HPV, human papillomavirus, which can cause cervical cell abnormalities that may lead to cervical cancer. The PAP test looked for cervical cell changes after they had developed but could not detect HPV. The cervical screening test can identify people at risk of developing cervical cancer much earlier, about 10 to 15 years, than the PAP test could. Because of this, women and people with a cervix aged 25 to 74 now only need to have a test every 5 years instead of 2. To be continued. Thank you for watching my video. For more videos, kindly like, share and subscribe.